Hi everybody, Dr. Daniel, and today I'm talking about the different types of migraine headaches. Well, the subject of migraine is confusing, mainly because there's so many technical terms attached to the word migraine. So what does all this mean? Migraine affects 12% of the world's population, including 25% of women and 5% of men. It often starts in childhood and then rises to become a lifelong, repetitive, persistent, sometimes disabling medical problem. For some women, it starts around menopause, a difficult time for many women, so that moderate severe headache is added to the cramping, bloody, hot flash time of a woman's life. Why are all these different types of migraine headaches discussed? So this article presents a short discussion of the different types of migraine. Well, the first is migraine without aura. Well, this is just 2/3 of migraine, and it's called now migraine without aura, but it used to be called common migraine because it is so prevalent. Probably it was just plain old regular migraine headache, really what it is, with the following symptoms. It's a one-sided headache for the majority, or about 80% of patients. Headache is moderate to severe, so it's 5 to 10 on a scale of 1 to 10. Headache duration is 4 to 72 hours. And the patients have throbbing headache, like you feel your heartbeat in your head. Headache comes with nausea in 70% and vomiting in 60%. Headache comes with sensitivity to light, photophobia, and sound, sonophobia. Headache makes the affected victim want to lie down and do nothing, as being up and being active makes the headache experience worse. Migraine with aura. Well, persons with migraine with aura have similar migraine features as listed above. Now, this type of migraine used to be called classical migraine. Some people will even think if you don't have the visual auras or that sort of thing, you don't really have migraine, which is wrong. So about 1/3 of the total migraine group have migraine with aura. Migraine aura symptoms usually last 10 to 60 minutes only, and the visual auras usually last 10 to 20 minutes. The aura refers to usual premonitory warning or aura before headache onset, but the aura part may come also in the middle of a headache or at the end of a headache, in which the term aura is really not relevant. The visual aura consists of seeing moving zigzag lines in both visual fields, which is more prominent on one side, although it is in both eyes, and that's called homonymous. The aura may be seeing half of things, bright dots, or spots which move, or blank spots where visual information may be lacking, called a scotoma. Sometimes, with the visual aura, the person may have a prickling numbness which starts in the fingers of one hand and then marches across the fingers individually and rises to the forearm and then especially to the cheek and tongue on the same side. Rarely for the migraine with aura person, there may be a disturbance of speech wherein it's difficult to talk or read normally for a few minutes followed by good recovery, and this is called aphasia. Next, we got menstrually related migraine with or without aura. This is when the migraine headache links to a woman's period coming the day of menstrual onset or 2 days before or after menstrual onset. The migraine here has the typical features of migraine with or without aura and comes during the menstrual cycle time and at other intervals during the month. Whereas pure menstrual migraine refers to women who only have their migraine headaches at the time of their menstruation, but not at other times during the month. For women, the migraines that come with menstruation are usually their longest and most severe migraine of all. Vestibular migraine. Vertigo comes from the Latin. It means to turn and feels like getting off a spinning merry-go-round at the playground when you're a kid. During vertigo, a person is sitting still and feels as if the world around him is spinning or moving. About 40% of persons with migraine may also experience vertigo. Vestibular migraine is a neurological condition that may come with or without migraine headache, where the person experiences vertigo, dizziness, an off-balance feeling. Vestibular migraine runs in families. Abdominal migraine. Abdominal migraine is a gastrointestinal or vasomotor autonomic nervous system-induced symptoms which occur in patients usually in the second decade of life between 11 and 20 years old. Patients complain of nausea, vomiting, stomach cramping, anorexia, and vague, centrally located abdominal pain around the umbilicus. It's not associated with severe migraine headache, but may come with mild or no headache at this young age. Like adult migraine, which occurs 3 times more often in women than men, more young adolescent girls have adolescent migraine than men. Then later in the 20s, the GI symptoms and mild headache turns into more typical migraine with severe one-sided headache, sensitivity to light and sound, and nausea and vomiting. Abdominal migraine usually turns into migraine with aging. Familial hemiplegic migraine. Familial hemiplegic migraine is migraine with R, which includes motor weakness and at least one first-degree relative who has migraine or with motor weakness. So it's got to be inherited and in the family. The International Classification of Headache Disorders requires 2 attacks of motor weakness with visual aura symptoms, sensory pins and needles type numbness, and speech symptoms. The R symptoms should not last longer than 5 minutes and less than 24 hours. Typical migraine headache should begin within 60 minutes of our onset and last at least 4 to 72 hours. Ocular migraine. In my opinion, this term is a misnomer. It's not used in the International Classification of Headache. And I go by the principle, if you want to talk to me, define your terms. And so ocular migraine is not well defined. Most persons are thinking of migraine with R type of visual events or retinal migraine when this term is used, and many non-neurologically trained doctors also mistakenly use it. Other terms along these lines are ophthalmoplegic migraine, which was in the first International Headache Classification, but now the ophthalmoplegia eye movement paralysis has been found to occur with many other neurologic conditions and migraine. Also, there is no specific ophthalmic migraine, which is not in the International Classification of Headache, which is really the Bible of headache and what we should use for terms. Retinal migraine. Light enters the eye through the pupil, goes to the retina, and then courses dorsally through the optic nerve and the optic radiations to the back of the brain in the occipital lobe. The visual workings of migraine are usually in the back of the brain in the occipital lobe, but retinal migraine must occur in the back of the eye. International Classification of Headache Disorders requires the patient to have experienced repeated attacks of migraine with R and then have R characterized by both of the following fully reversible monocular positive and or negative visual phenomena, such as scintillations, scotoma, or blindness. They got to be confirmed during an attack by either or both of the following: a clinical visual field exam, the patient's drawing of a monocular field defect made after very clear instruction, and at least 2 of the following: a spreading of the image gradually over slightly over 5 minutes. The symptoms last 5 to 60 minutes, and it should be accompanied or followed within 60 minutes by headache. It's not better accounted by any other diagnosis or either cause of lack of vision. Now, some people complain of monocular vision disturbance, in fact, have hemanopsia, visual loss in the same part of the eye in both the right and the left eye, such they would have visual loss in the right eye portion, the nasal part next to the nose, in the left eye, and the temporal portion close to the ear. So hemanopia originates in the back of the brain, the occipital lobe, not in the retina. Some cases without headache have been reported as retinal migraine, but migraine is the underlying etiology of those cases cannot be ascertained. So retinal migraine is a somewhat controversial and extremely rare cause of transient monocular visual loss. Cases of permanent monocular visual loss associated with migraine have been described. Appropriate investigations are required to exclude other causes of transient monocular blindness. Retinal migraine is a migraine visual aura occurring just in one eye, or what may be referred to as a monocular distribution, rather than the usual bilateral homonymous pattern. In a homonymous pattern, the observant and carefully instructed patient may notice the visual aura in, for example, the left halves of both eyes. The visual aura should be followed by a typical migraine without a headache. Whew. Migraine with brainstem aura. Migraine with brainstem aura is the type of migraine with aura attacks with symptoms from the brainstem causing headache on the back of the head and visual auras and numbness and tingling on both sides of the body, left and right. It was originally described by Dr. Bickerstaff, but now it's been changed to the current name of migraine with brainstem aura. According to the International Classification of Headache Disorders, migraine with brainstem aura has the following features. It occurs with neurologic symptoms that would include at least two of the following: slurring of speech, called dysarthria, a sensation of movement, vertigo, ringing in the ears, tinnitus, double vision, called diplopia, unsteadiness when walking as if drunk, ataxia, temporary decreased consciousness, syncope, pins and needles and or numbness affecting both arms and legs, changes in eyesight in both eyes, such as patterns or flashing lights. Migraine with brainstem aura symptoms often develop gradually and occur with or before a typical migraine headache in those who experience it. Migraine brainstem aura occurs in about 1 in 10 people who get migraine with typical visual aura. Vertigo, dizziness, slurred speech, ringing in the ears, and double vision also commonly occur. Some people experience disorientation or confusion as well as temporary loss of consciousness known as syncope with this syndrome. Chronic migraine. Chronic migraine is defined as having 15 or more headaches in a month's time, 8 of which have the features of migraine, occurring for 3 months in a row. Most persons with chronic migraine are overtreated with painkillers, narcotics, caffeine, or barbiturate drugs, and also have developed medication overuse headache. Episodic migraine is defined as having 14 or less migraine headaches in a month. Status migrainosus. A migraine that lasts for more than 72 hours is called status migrainosus. The usual time for a migraine, really most of the time, is 4 to 5 hours, but status migrainosus is named for attacks that last 3 days or longer. This type of migraine obviously does not respond well to treatment, or they would have stopped earlier. All migraine patients should be counseled to treat their headaches the onset with one of the triptans, which are still the best drug for acute migraine treatment, but 70% of persons with migraine have never had a diagnosis of migraine made by a doctor or given a prescription for more effective migraine treatment than something like over-the-counter like Excedrin. Status migrainosus occurs more frequently in persons with chronic migraine from medication-induced headache and is a headache that quickly gets out of control and is very hard to treat. Weekend migraine. Migraines tend to occur either during stressful times or with reduction of stress, as in the weekend where you can sleep later, eat breakfast later, drink your 2 cups of coffee later, and relax with a down weekend at the end of a stressful week. Then bam, your weekend headache greets you under the covers while you're still sleeping in and definitely not ready for it. The terms Saturday morning headache and Sunday morning headache relate to similar migraine situations occurring at a time free from stress. Acute confusional migraine. Acute confusional migraine is the development of acute altered sensorium with confusion, irritability, drowsiness, nausea, or vomiting following mild, non-concussive head injury. It primarily affects only children and adolescents. Although migraine has been studied since Hippocrates, and he mentioned sick headache in 400 BC, and Galen described hemicrania in AD 200, acute confusional migraine is in the beginning stage of medical research. Few case studies appear in the medical literature. Researchers had recommended that acute confusional migraine be added to the official International Classification of Headache Disorders as a migraine variant, but that hasn't happened yet. But writers of this opinion think unity with ICD-3 may help practitioners and others more easily recognize this type of migraine. At times, confusional migraine may occur spontaneously, but most of the patients have throbbing headaches when they recover enough to describe how they feel, and they go on to develop migraine later in life. There's an increased history of migraine in the family of affected patients. Tests such as CT or MRI scan of the brain are normal, although the EEG is typically slow during the attacks and becomes normal after recovery. The syndrome occurs mostly in young children or adolescents who remain amnestic for what happened during the event. I mean, they don't remember what happened. Occasionally, patients may have recurrent attacks. Acute care physicians should have acute confusional migraine in their differential diagnosis, that's ER docs, along with other possible more concerning neurologic diseases such as subdural, epidural, or subarachnoid hemorrhage, meningitis, non-convulsive seizure, postictal state, or metabolic disorder. Footballer's migraine. What has come to be called footballer's migraine is really a syndrome of symptoms of fortification visual images, numbness and paresthesia, usually one side of the body, in the arm and face, and rare hemiparesis followed by a throbbing headache, much like that of an attack of migraine with aura. These events occur minutes after mild, usually non-concussive head trauma, such as may be sustained in soccer, boxing, or mild accidental head trauma. Many of the patients may have a spontaneous typical migraine before or after the traumatic event, and most of them have a history of migraine in their family. Footballer, in this sense, refers to a soccer player and not to an American type of football player. Footballer's migraine is not mentioned in the International Classification of Headache. Cortical spreading depression. The current view of pathological changes in these patients with footballer's migraine is that trauma induces Liao's cortical spreading depression, a reaction of neuronal and glial depolarization passes like a wave over the cerebral cortex and then resets. Migraine triggered seizure. Migraine triggered seizure. Migraine and epilepsy are prototypical examples of paroxysmal brain disorders, while migraine-like headaches are quite frequently seen in the epileptic postictal period. Sometimes a seizure occurs during or following a migraine with aura attack. This may be related and referred to as migralepsy. Migralepsy, a rare event occurring, usually described in patients with migraine with aura. Evidence for associated with migraine without aura is still currently lacking, I believe. This is an epileptic seizure occurring during or within an hour after an attack of migraine with aura event. Migraine and epilepsy, consider, are both comorbid episodic paroxysmal disorders. Persistent aura without infarction. Very rarely a patient with migraine with aura will experience a persistent visual aura, seeing zigzag lines for a week or something like that. This is a rare but well-documented condition, and there should be persistence of migraine aura for more than 1 week without neuroimaging evidence of infarction. So there's no stroke. The MRI is normal. The auras are usually present in bilateral visual fields and central vision and superimposed on normal vision. Silent acephalic migraine. This is the occurrence, usually in my experience, in middle-aged and to older women of events of typical visual membranous auras occurring in the usual 10 to 20 minute time. Often this occurs in women who have had very mild migraine with aura attacks or migraine-like attacks, such as menstrual headaches, hungry headaches, nocturnal headaches, or weekend let-down headaches previously. But these patients have never seen a doctor for headache or migraine because their experience has been only of trivial, easily treated headaches. Sometimes men are affected with this. The occurrence of the visual aura, typical migraine, however, does mark them as a person with migraine. So thank you very much for listening to this kind of long talk about the different types of migraine. I hope it clarifies things for people. Please click on like and subscribe down there, and I'll see you again on the next talk.